Hello, today we're taking a look at Resuscitation. This is a free medical app that's an award-winning virtual patient simulator that makes learning medical addictive. In a sense, it adds a gamification aspect to that of the medical field where you can look at tech. It is a very, very technical medical simulator that goes through and is designed mainly for health students and professionals who are interested in learning about patient care. You literally go through the steps from forming diagnoses and diagnoses, I should say, and getting about and virtually performing certain procedures here. So you can see you have play, you can view your own progress here. So you can see the one I did earlier as a gynecologist. You can see what I did there. You can see if I got my total points, my completed achievements, only 1 out of 30. And in this case, I got in the 12% range of medical students there, the score I should say. Now you also have feedback, help, and of course you hit play. Now you can pick from a list in terms of the cases. You can get any random case, a random unplayed case, or buy new cases through in-app purchases. From picking from the list here, you can see there's a lot of different ways to filter this. You can do it by module, topic, rank, or setting. So let's go by rank, for example. And you can see the ones that are unplayed, and also by topic. You can see certain, so for example, neurology, OB/GYN, respiratory or toxicology. So let's go with toxicology, for example, in vomiting and abdominal pain. So here we have a 41-year-old woman who presents the ER with vomiting and abdominal pain and chest pain. So first off here, we can place the IV, and then you want to choose between the IV. So you can do a central line IV or a peripheral IV or an intravenous, intra here IV. We'll just go with this one right here. Select oxygen. And then obviously you're all being graded in all this. So you can see your actions performed, whether it's critical, bonus, harmful, or unnecessary. So you can see I already did one that was unnecessary there. So I can change that and fix that. So it will be a peripheral IV and choose the oxygen type. In this case, since she's having chest pains, I would imagine you would go through nasal. And again, it tells you if you're wrong or right. In the end here, you can place the monitor, of course, at the top here. You can see her overall stats, her BP, and her heart rate. Additionally, you can see her medical history here. So it gives you a full-on medical history. So you can see family history, social history, allergies, etc. Going down the list, you would see for an exam, you can see how she did in the basic exam, how her abdomen, you can see here it's soft and diffusely tender. And then from there, you can go on to make a diagnosis. So in this case, you can say if it's cardiovascular, you can see all these like abdominal or an aneurysm or congestive heart failure, complete heart block. You can go through all of these really. There's a lot of different, obviously, diagnoses that you can make. You can pick from multiple of these ones. So you can see this case has 18 correct differentials and 1 correct final diagnosis. So obviously at the end it comes down with 1. So again, just totally guessing going into cardiovascular here. Let's say if it was chest pain and unclear etiology, I can continue with the diagnosis. I can place orders of what she may need. Maybe she needs medicine or radiology. She needs more, lab tests or whatever that may be. You can order those, and at the end, you could review your results. So if I was to say finish here, obviously, at the end, it's going to say I would choose my differential from my differential diagnosis, and I would choose the final disposition for the patient. So in this case, I think I would, you can say admit to ICU, OR for a procedure, admit to floor, and if I said OR for a procedure and hit finish, it would tell me overall how I did. In this case, you can see I scored very poorly, and my correct actions were only as far as placing, looks like, the cardiac monitor and the IV. So in this case, I was wrong. But this is, at the end, it gives you the full results, gives you the details of what you got wrong and why. You can see the discussion, you can replay it, or even email the authors. And that's the gist of the app. It's a free medical app. You can find this Resuscitation in the App Store today.